It hasn't been the biggest year for healthcare mergers and acquisition, but there have been some very exciting developments. So there are three that I want to talk about today. And the first one is, of course, Gilead Sciences. So this company has been in the news ever since the pandemic began and remdesivir became a notable treatment for COVID-19 patients. But there's a lot more to this company than its COVID-19 treatment. So, Gilead's strategy for a long time, even before its current CEO, Daniel O'Day, came on in 2019, it's been acquisitions, growth through acquisition. So, they acquired Kite Pharma, a cancer immunotherapy, in 2017 for about $12 billion. Immuno-oncology and immunotherapy, that's something we're going to talk a little bit more about. Cory, what does that mean?
Okay, so in a nutshell, immuno-oncology means using the immune system to fight cancer. Now, this is a really big deal because all of us, we're always getting cancer all the time. But the diseases we think about as cancer, something that leads to a diagnosis from a physician, that's what happens when immune systems are somehow prevented from attacking tiny tumors before they become troublesome, in a nutshell.
Very interesting. So that's been pretty important for Gilead's strategy. They've really been building on their cancer treatment business. So it started with Kite Pharma in 2017. This May, they bought 47, a clinical stage immuno-oncology company, for almost $5 billion. And the most recent one is Immunomedics. That was announced in September. They're paying $21 billion for it. It's supposed to close in the fourth quarter, so probably soon. What does Immunomedics add to Gilead? What that they don't already have?
It adds a commercial stage drug called Trodelvy, if I'm pronouncing that right. Have you heard it pronounced yet?
I haven't. As a lot of times with these drug names, I'm just guessing.
I am the worst. I've never been close when I finally hear it. Anyways, I'm going to go with Trodelvy, Trodelvy. This is an drug that you might be surprised to learn by the company's name isn't actually an immunotherapy. It's an antibody drug conjugate that targets TROP2. This is a protein on the surface, commonly found on the surface of tumor cells. It's a great target, as it turns out, for this drug Trodelvy, which one side is an antibody, a protein that will recognize TROP2, and then it drops off a small dose of chemotherapy that doesn't become active until it enters the cell that it's trying to kill, which should be only tumor cells. Antibody drug conjugates have been on the market for quite a while. They've done well. This is the first time one has been approved for triple negative breast cancer. That's breast cancer that doesn't react to the three most common targets used to treat breast cancer.
Can you tell us anything more about Gilead's core business? Is it pursuing this kind of growth strategy because its own R&D isn't coming up with quite enough? Or is immunotherapy just so hard that it makes more sense to acquire companies that have really already found the proof of concept?
Gilead's R&D strategy hasn't been terribly productive in recent years. That's putting it lightly. Although they have done extremely well with their HIV drugs, Biktarvy and Biktarvy and the other ones. But this will add some revenue right away. It's hard to say if it's going to be enough to make up $21 billion worth of company.
Yeah, absolutely. So they have a whole suite of HIV they have treatments and prophylactics, so preventative medicines for HIV, and that has really been a big driver for Gilead. So, they have remdesivir, but they I think they donated a large amount of those doses. So questions about how much that's really helping them financially. Before we move on to the last stock, the next stock, what do you think of Gilead Sciences as an investment? Do you think it's a good buy? Do you think it will outperform the S&P 500? Any thoughts more broadly?
So there isn't a lot of room for error for Gilead right now. Uh, uh, as a stock, it's trading at a very low multiple with a good. I think the dividend offers a yield over 4% right now. And with HI revenue coming in pretty steadily, you can probably depend on that. It's just that now that filgotinib, the company's rheumatoid arthritis drug that was licensed from Galapagos, now that's fallen through, or at least hasn't been the FDA approval. They received a complete response letter, so that's been delayed for a long time. It's nervy. I think you might be able to find better pharmaceutical stocks out there right now than Gilead Sciences.